than 100 children across at least 14 states that have contracted a rare and potentially deadly inflammatory condition likely linked to COVID-19. Joining us now, Morning Joe Chief Medical Correspondent Dr. Dave Campbell. And Dr. Dave, explain the connection that this condition has with COVID-19 and how concerned should parents be about their children getting this? How prevalent is it?
It's still rare, Mika. This is a condition that comes on typically weeks after the symptoms of COVID-19 go away, if there were symptoms at all. Most of the kids that have this either test positive for the COVID virus, for the coronavirus, or they test positive, even more of them, for the antibodies. And this is something, as even Dr. Fauci just mentioned, is similar to Kawasaki syndrome, which is a vascular disease. It's an inflammatory disorder of the blood vessels, and it affects multiple organs at the same time. It's usually not fatal, but as we know now, there are at least 3 children in the state of New York that have died, and there are now 9 more states that have patients, young kids typically, but up to 18 years of age have been identified so far that have this pediatric multi-system inflammatory syndrome associated with COVID-19. Mika.
So I'm just curious, I'm thinking out loud here, but the relationship that this has to COVID-19, does that raise any questions about the coronavirus, that there could be other syndromes out there that will pop up? I mean, what does this tell us?
This would suggest that there is an immune response that happens to target the blood vessels and organs in general, because every organ, of course, is supplied by blood and have blood vessels. So it's an immune response that comes after the virus has typically resolved. It doesn't suggest that we should be thinking of other similar syndromes, but it does link back to both Kawasaki syndrome and even toxic shock has some similar type problems that are associated with it, although toxic shock is in the aftermath of a bacterial infection, and this, of course, is the aftermath of a viral infection. It's rare, but it is still telling us that children are not as immune to disease and problems as we thought even a month ago.
I want to ask you about antigen testing, but let me just go over the symptoms for parents. It's a prolonged fever lasting more than 5 days, severe abdominal pain, diarrhea, vomiting, patchy blue or pale skin discoloration, trouble breathing and rapid breathing, lethargy, and a rapid heart rate. And that is signs of this syndrome that has come up in at least 100 kids and 3 children that we know of have died. Now, the FDA has given emergency authorization for new antigen testing to help detect the coronavirus quicker and cheaper. Where does this fit in the grand scheme of testing and all the confusion out there, because we have so many different states and entities competing with themselves?
This is a good natural progression of the scientific efforts. So this new testing that just got approved is allowing this particular company to take a look at pieces of the proteins that come out of or are part of the virus. So it's a very rapid test. It is extremely accurate. When this test is positive, you basically can be sure that you have COVID-19. If the test is negative, you can't be sure, and you still have to wait on the more sensitive test results from the PCR test, but that takes typically hours or even days. So this new test is very important because it's inexpensive, it can be scaled up rapidly, it can be showing test results within minutes. So if you need the information quickly for treatment purposes, you're in a hospital, you're in an emergency room, this test will come to be very valuable. But don't forget, if it's negative, you still have to wait on the PCR test result, the polymerase chain reaction test result, which is still the standard that's out there, Mika.
Dr. Dave Campbell, thank you very much. Willie?
Welcome.
Let's bring in Dr. Stephen Corwin. He's president and CEO of New York Presbyterian Hospital, one of the largest hospital systems with 10 hospitals and more than 200 primary and specialty care centers in the New York area. Dr. Corwin, good morning. It's good to have you back on the show. I just would love a snapshot from you on your hospitals right now. Obviously, we were all so laser focused on the conditions in your ERs and your ICUs over the last several weeks. If I walked into one of your ICUs this morning, how different would it look than, say, a month ago?
Well, we're a lot better. At our peak, we had over 800 patients in our ICUs. We're now down to about 400, which is still a huge amount, but it's half of what we had. And we're down to about 1,100 total COVID patients, down from a peak of 2,600. So we still have a ways to go, but we feel a lot more secure about this, especially as we see the curve moving down and continuing to move down. Much better. What we have seen, to Dr. Campbell's point, is we now have seen 35 cases of this CMIS, this multi-inflammatory syndrome in children. 80% of those require ICU care. Interestingly, 70% of the cases that we've seen are Caucasian children, which is unusual in terms of our usual demography. So we don't think that this is going to have a high prevalence, but it's still very worrisome in terms of kids carrying the virus and then developing this syndrome. So we are now seeing that.
So what is the connection, for people not familiar with that condition that you're describing in children? What's the connection between coronavirus and CMIS?
Every one of these kids either test positive for the virus with PCR, the PCR test, or have had the COVID virus and test positive for antibodies. So this is clearly related to an inflammatory response to the virus. And in the adults, of course, the hyperimmune response is what happens in the lungs. This is a Kawasaki-like syndrome, and can affect the heart, the kidneys, the brain. So it's very worrisome that when these children develop this post-COVID.
So if I'm a parent, Dr. Corwin, and my child has tested positive for coronavirus and maybe recovered now, what am I looking for? Because this will put up a lot of red flags for parents whose children have had coronavirus.
Fever, lethargy, abdominal pain, rash, shortness of breath in some cases because it can affect the heart. But typically high fever, lethargy, rash are the things that you look for, and abdominal pain is pretty characteristic of it. And as I said, 80% of these children require ICU care, so please get to your doctor with that if you think your child has this syndrome.
Dr. Corwin, you've talked quite a bit over the last few weeks about some of the failures in preparation for this pandemic, the things we thought we were ready for. Quick testing is one of them. PPE was another one. What now do we learn from what you all have been through and you continue to go through?